You know what's been difficult that they don't really prepare you for in school is those scenarios where the family of the patient in question is wondering as to the progression in the care.
That patient room?
Yeah, put them in your patient rooms too. As asking about the progression or the care of their loved one. And you can't really tell them, why they're not progressing or not, getting better than where they were. They were probably in a point where they were weaning, they were doing pretty good on pressure support settings, and then, in conjunction with other systems and organ failure, hey, they are not doing that well this week. And it's just how you handle those critical situations is something you have to figure out for yourself. You never quite know how to answer those questions because it's person to person basis. Everybody isn't the same. Everybody's body doesn't react to the wings the same. Sometimes they may be doing good on a person on a certain wing at one point in time, and then they might have an issue with cardiac, where they might be in CHF or some kind of renal issues, and they're no longer responding to the therapy the way they were, and the family becomes so disheartened, and they become so they don't really know how to digest it or how to handle it. And you have to explain to them that sometimes patients have a rebound. They're not doing as good as they were, but we'll keep on working on trying to rehab the patient and getting them back to some semblance of health. But patients just want to see their family get better, and it's not always the case. Sometimes it's the opposite effect. Sometimes they are going the opposite direction, and they're not doing as good as projected them to do. So just getting in a sense of how you talk to family members and being compassionate and just being a little bit patient with them in those situations it's something that you have to get used to, that you kind of don't get prepared for in school.